Good afternoon. Welcome to the Office of Community and Rural Affairs public hearing for the Recovery Housing Program. This is for the action plan for the allocation from 2024. My name is Pamela Guerrero. I'm the Senior CDBG Program and Policy Analyst, and today I'm joined by Tanea Simons, the CDBG Program Manager that will be overseeing the RHP program, as well as Steve St. John, who is our CDBG State Program Director, and with our partner here, Kelly Walker, from the Director of Addiction Services at FSSA. So for today's public hearing, there's a couple of items that we're going to be covering. We'll cover some introduction and housekeeping, a little background of how the office has been helping in rural communities through its creation. We'll give a couple of overview and backgrounds on the actual recovery housing program, some of the proposed changes to the 2024 allocation. We'll provide information on the actual amendment, and we'll open up for any public comments virtually or actually for anybody that is present in the room. All right, so for introduction, to make sure that everybody is able to attend and participate, we'll just ask that whenever there's a question, to just wait for you all to be called so that you are able to provide your comments. We do ask that you hold your comments up to 3 minutes at a time. And if there's any specific detail information that people are looking for, we'll just recommend for those to be emailed to us so that we can provide better information and we can better record them for the transcript and for submission to HUD. All right, so a little background on the Office of Community and Rural Affairs. So OCRA was developed as an agency to meet the various needs of rural communities. We know that rural communities have a lot of pressing needs that require outside financial resources, and the office is charged with the administration of the Community Development Block Grant. So through this funding that is received to the state from HUD, we are able to meet communities' needs through different competencies. We do it through infrastructure needs. So we invest CDBG funds for basic infrastructure needs like wastewater, sewer, public facilities, and some owner-occupied housing. We also work closely to make sure that communities have the capacity that they need. So we have some programs that build their local capacity to meet their current community needs. We also do it through economic development. Most of these ones are state programs now. So these include site certified as well as other state funded programs. And we also have quality of place. So these are the projects that we invest funds in to make communities more attractive for people to want to stay and also live in those communities. So a little bit of background on the actual recovery housing program. So this funding is a special allocation that OCRA receives. We started receiving this funding from starting 2020, and we have continuously seen an allocation each year after that. The funding and the program were created under the Support Act from Congress that's intended for Patients and the Communities Act. So the administration is as a pilot program through the U.S. Department of Housing and Urban Development through the Community Planning and Development Office. So not only is this a pilot program for us, OCRA, but also for the federal government and HUD, the agency. I provided a little of detail about the CDBG, or also called Community Development Block Grant Program. HUD ended up kind of adjusting some of the regulatory components from CDBG in order to us being able to administer the recovery housing program. So some of this were introduced as waivers to our regular CDBG program to make sure that we are meeting the Support Act legislative intent. So this program changes who is actually eligible to apply. So it's open for entire state. rather than just non-entitlement communities. And we also are more concentrated in adjusting who is able to qualify for assistance. So this is done through the changes in national objective, which is adjusted for us to make sure that this program is serving people in need of recovery in services. Some of the important changes that were also made include the eligible activities. So what funds can actually be invested for. HUD ended up kind of providing waivers through the program so that some of the regulations from CDBG are adjusted and are more flexible to meet those needs of recovery residencies. So the allocation criteria, so HUD allocates funding to states as well as the District of Columbia based on the age-adjusted drug overdose rates that the state has. So this is based on the above the national average per CDC data. And there's also a formula that was published in one of the federal registry notices to identify how much funding each state and qualifying a state and the District of Columbia will receive. So this funding is not available to all states. They just need they need to meet a very specific requirement based on the actual drug overdose data that the state produces. So Indiana does have a deficit and a high debt rate for overdose, particularly opioids, and so that's why the state does receive this allocation. Okay. So some of the program purposes, so RHP provides funding to states as well as the District of Columbia for stable and temporary housing for individuals recovering from a substance use disorder. The Recovery Housing Program seeks to support recovery efforts by helping individuals transition to permanent housing and self-sufficiency. So the assistance is available for individuals for no more than 2 years or until the individual is able to secure permanent housing, but whichever one is earlier. So the maximum a person can be under this program is for no more than 2 years. The types of programs that we are able to fund with this allocation must benefit low and moderate income persons, and all of our actual allocations and all of our awardees need to make sure that they are complying with the federal requirements, which include fair housing, non-discrimination, labor standards, environmental requirements, and we do highly encourage, as well as the federal government highly encourages, for wraparound recovery services. So we are able to better support people in recovery. Okay. So from the 2024 proposed recovery housing program allocation, the Consolidated Appropriations Act of 2024 that was passed during the last Congress, March 9th of 2024. It funded the Community Development Block Grant as well as the Recovery Housing Program through the rest of September 30th of 2027. So this is where OCRA received the allocation from 2024. Have published our actual formula and the amounts that we were going to be receiving last year. So this is again 2024 allocation that we will be utilizing for the program year of 2025. So this allocation is combining any prior allocation that OCRA has received from 2020, 2021, 2022, 2023, and 2024 into one single action plan. So any remaining funding from any of these allocations that we may have will be allocated towards this specific action plan. So the most recent allocation that OCRA received was the one from 2024. And we were allocated $1.206,668 and with a total of $4.9 million altogether from the past couple of years. Okay, so our proposed allocation for the actual program funds is that we will be setting aside $1,646,526 for actual program funds. So these will be the funds eligible for applicants to submit requests for funding. And then 5%, which we are allowed to have as administrative costs, will be used by OCRA for paying of direct staff administrating the program. So this is the first time that OCRA has actually tapped onto the administrative cost caps that HUD has allowed us to do, and we are taking this cap this time around. Okay, so there's a couple of things that have changed for this program that I will walk you through. So first off, the eligibility of the applicants. This program is open for entitlements as well as non-entitlement communities, as well as Indian tribes in the state of Indiana. And any local government that is interested in partnering up with a subrecipient that's eligible to actually demonstrate that they have a not-for-profit tax status are eligible to partner up with a local unit of government to participate in this program. The maximum award for this program will be $750,000 for one award, and we have waived the regular beneficiary limit that we normally have, so this will not be applying towards this program. We also don't require a match for the program, but we do highly encourage communities interested in the program to leverage any additional financial resources that they may have. For the eligible activities, we have revised this one significantly to meet some of those pressing needs. In conversations with Kelly and FSSA, there were a couple of other needs that recovery facilities have. One of those being lease, rent, and utilities. So that is now a new activity that we have incorporated into our action plan. And we do still highly encourage applicants to utilize grant funds to cover for any administrative costs. All right. So for our actual action plan amendment 4, we have revised some of the significant eligibility criteria as well as the grant evaluation criteria, like I mentioned before. So we will still require applicants to reach a minimum score of 450 so that they're able to qualify for actual grant funds. We have revised the national objective to better align with what the program aims to do. So the national objective will still need to follow the low and moderate income limited clientele, but the documentation requirement has changed. So we will require applicants that eventually become awardees to submit transitional recovery housing program admission documents for us to ensure that, even new facilities are able to meet the national objective. So our goal is to open the program for new facilities that haven't done it before. So if there's a project that needs acquisition as well as construction, we're able to meet that demand without them having any prior experience or data collected. And then we also have a local match contribution. Again, this is not a requirement, so that is why the points for this section have been reduced. It used to be 50 points. It has now moved to 25 points. So any local match contribution is welcome. And we do provide additional points if communities are leveraging any opioid settlement funds that they have that will contribute towards the application. All right. So in the same grant evaluation criteria, we have also revised kind of the sections here for us to better align with FSSA requirements. One of them being the Indiana Recovery Residence designation. So a maximum of 30 points will be allocated to a facility that will or is already a designated facility based on the different levels. So level 2 designation will receive up to 10 points. Level 3 designation will receive 20 points. And level 4 designation will receive 30 points. So this will align more on the efforts that FSSA has for us to be able to expand and have more Indiana Recovery Residency designation, because these ones they meet better standards from NARA standards. So one of the other things that we saw through our prior program last year, it was the lack of feasibility studies. So we're encouraging communities to have a plan in place in order for them to submit an application. So that will be any community that submits a recent feasibility study or design documents for a facility will have an additional 30 points towards their application. And then for project design factors, we have 300 points altogether for sections on project description, project need, financial impact, and actual meeting the Support Act goals. All right. So for our section in program specific points, these are kind of like additional points if a community wanted to leverage these ones. We have increased the points in this section, so up to 65 points more can be incorporated in a total application total. So if a community is a non-entitlement community, they will receive an additional 10 points. If the facility will reserve beds to pregnant women or women with dependent children, they will receive an extra 15 points. And this is really to meet the need of the lack of this type of beds available statewide. For any facilities that will have beds reserved for individuals with justice involvement, they will receive an additional 10 points. For beds available for veterans, which is also a significant need that the state has, they will have an additional 15 points towards their application. And for project sustainability. So if the community has documented that they are using national opioid settlement funds towards the project match, they will receive an additional 15 points because, we're leveraging additional funds. And then for the bonus points, we have aligned this section with FSSA, Division of Mental Health and Addiction, to encourage more policies for the actual recovery facilities that will meet medication assistance treatment. So this will be kind of the submission of policies that the facility intends to utilize for them to be better prepared to actually utilize medication and trauma-informed care approaches in the way that they are administering and taking care of the people in these facilities. So an additional 25 points will be allocated to those applicants that submit these additional bonus points. Okay, so do we have any public, are there anybody in person, Tanea?
No.
Okay, so we don't have anybody online either. So we can solicit public comments right now. But if the public is still interested, we are receiving public comments through August 8th, 2025. And people are able to submit these comments to us via email at cdbg@okra.n.gov. If you want to go old-fashioned, you are also eligible to send us a letter. We are located at the 1 North Capitol Avenue, Suite 600, Indianapolis, Indiana, 46204. And you may just, write that letter, attention to Recovery Housing Action Plan Amendment comments. And our action plan is online. It went live yesterday, since public comment period started yesterday. So that's available on our website. And it will be there for the next 30 days. We are hoping to submit this action plan to HUD on or after August 15th. So we will be collecting comments all throughout. Yeah, I'm going to stop recording.